Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Breast self-exam. BSE. Introduction. Breast self-awareness is an understanding of how your breasts normally look and feel. Some people perform a breast self-exam, or BSE, to learn what is normal for them and to notice changes that may happen. A breast self-exam is a checkup that a woman does at home. During a BSE, a woman checks for any changes in her breast tissue. This program explains breast self-exams. It covers the anatomy of the breast and how to do a BSE. Anatomy. Breasts contain many tissues, including the glandular tissue in the upper outer part of the breast, surrounding fat tissue felt in the inner and lower parts of the breast. The glandular tissue usually feels firm and slightly rope-like or bumpy. The surrounding fat tissue is soft. Breast tissue changes as you age. It typically becomes fattier and less dense over time. Sometimes the skin of the breast may become coarse and wrinkled. This could be a sign of breast cancer. Discharge from the nipple or a lump in the breast can also be a sign of breast cancer. Women who know what their breasts normally look and feel like can spot changes in the breast early. You might find that breast-related symptoms, such as tenderness or lumpiness, change over the course of your menstrual cycle. Breast self-exam. Feeling a lump can make a woman anxious about the possibility of having cancer, but most breast lumps are not cancer. When a woman thinks she has cancer but doesn't, it is called a false positive. The unnecessary anxiety this can create is one reason why breast self-exams, or BSEs, are no longer widely recommended for cancer screening. On the other hand, although a woman may not feel or see any changes in her breasts, she may still have cancer. This is known as a false negative. If a woman only uses BSEs for cancer screening, a tumor may not be found early enough for successful treatment. BSEs are not a replacement for screening tests such as mammograms. Your healthcare provider can recommend when to start breast cancer screening. But being familiar with your breasts can still help you find breast problems other than cancer early. Discuss any breast changes with your healthcare provider. You can continue to monitor your breasts when you are pregnant or breastfeeding. You can also choose to examine them after you have gone through menopause or if you have breast implants. Your hormone levels change each month during your menstrual cycle. This can cause swelling and other changes in the breast tissue. Swelling starts to go down the first day of your period. Women who want to perform BSEs should do so a few days after their period ends. If you have gone through menopause or if you do not menstruate, you can do your BSE on the same day every month. To do a BSE, take off your shirt and bra. Face the mirror with your arms hanging by your sides. To inspect your breasts visually, face forward and look for areas where the skin sinks in or sticks out. Notice if the breasts are uneven or if they have gotten smaller or larger. Also look for changes in the shape of the breasts. Notice whether the nipples are sticking out or in. Examine your breasts while putting your hands on your hips. Examine your breasts while raising your arms above your head and pressing your palms together. Lift each breast to see whether the part underneath looks the same in each breast. If you have a disability that makes it hard for you to examine your breasts, ask a close family member or a trusted friend to help. Next, examine your breasts with your hands. Lie down on your back on a flat surface. Breast tissue can spread out while you lie down. This makes it thinner and easier to feel. Use the pads of your 3 middle fingers. Don't use the very tips of fingers. If you don't have as much sensation in the pads of your fingers, use the palm or the back of the fingers. These areas of the hand are sensitive. Apply different amounts of pressure to feel different layers of breast tissue. The 3 levels of pressure you should use are light pressure to feel the tissue closest to the skin, medium pressure to feel a little deeper, firm pressure to feel the deep tissue close to the ribs. Take your time while you check your breasts. You may need several minutes to examine each breast. Place one hand behind your head and fully examine your entire breast with the opposite hand. Using your 3 middle fingers, start at your collarbone and move toward your nipple. Be sure to use all 3 pressure levels to feel all of your breast tissue. Carefully sweep or move around your breast. Start again from your collarbone and move toward the nipple. Now examine the other breast with the opposite hand. Raise your arms and look at your armpits. Look at your nipples and gently lift the areola, or the colored part around the nipple, to check for liquid, called discharge, coming out. A BSE can also be done while you're in the bath or shower. Some women discover breast masses when their skin is moist. Use soapy hands and fingers to check your breasts. Write down what you notice in a notebook. You can draw a picture in the notebook to help you remember what you found. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. When to contact your healthcare provider. Most women have some lumps in their breasts, but if you find any new lumps or other changes in your breast tissue, contact your healthcare provider right away. Contact your healthcare provider if you notice any of these changes during a BSE. Breast swelling, warmth or redness, change in the size or shape of the breast, nipple sores or rash, enlarged lymph nodes in your armpit. Regular health exams and tests can help find problems early or before they even start. Regular checkups provide a number of benefits to women. Screening tests, such as mammograms, can find diseases early when they are easier to treat. If the breast lump isn't cancerous, your healthcare provider may suggest short-term monitoring followed by another exam in a few months. Contact your healthcare provider if you notice any changes in the lump or if you develop any new areas of concern during this time. If the breast lump is cancerous, you and your healthcare provider will work together to create a treatment plan. The stage and type of breast cancer may affect your treatment options. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Breast self-awareness is an understanding of how your breasts normally look and feel. Some people perform a breast self-exam or BSE to learn what is normal for them and to notice changes that may happen. Women who know what their breasts normally look and feel like may spot changes in the breasts early. You might find that breast-related symptoms such as tenderness or lumpiness change over the course of your menstrual cycle. You should still know how your breasts look and feel when you are pregnant or breastfeeding. This also applies to women who have gone through menopause or who have breast implants. Your hormone levels change each month during your menstrual cycle. This causes changes in breast tissue. The best time to perform a BSE is a few days after your period ends. If you have gone through menopause or you do not menstruate, you can do your BSE on the same day every month. To do a BSE, take off your shirt and bra. Face the mirror with your arms hanging by your sides. Look for changes in your breasts. Then use your fingers to feel for changes standing up and lying down. BSEs can help you find breast changes to discuss with your healthcare provider, but BSEs are not a replacement for screening tests such as mammograms. Thank you for using Explain.